As more and more of us are developing immunity because we're getting additional vaccines, or we're getting vaccines along with getting COVID infections, the level of immunity in the community is increasing. Eventually, we expect that COVID, which is a coronavirus, just like other coronaviruses that may cause the common cold, will become endemic and no longer be the markedly contagious disease that we have now. The unknown in all this, though, is the ability of COVID-19 to mutate. We learned a lesson from influenza, which is another virus that mutates very frequently. And that leads to problems when the vaccines that are manufactured no longer match the virus that has mutated after the vaccines are manufactured. That's what causes some influenza vaccines to be less effective in any one season. Now, we've gone through several mutations of COVID, as you've all heard. The terms, the Delta, which was the one that was most virulent, able to cause serious infection. Now Omicron, which appears to be very much more contagious, but possibly not as severe. So it's possible that Omicron may be doing us a favor in a sense by creating more immunity in a large population without doing as much damage. And that could potentially help us to fend off future mutations, which are very likely to occur considering how many people across this globe have COVID infection at the same time.
It does look like if you're completely unvaccinated, never been infected, that Omicron can still cause severe disease. And one thing that we've learned from both the UK and South Africa is that, these variants are mutating to find a population that's most susceptible. And unfortunately, there are, our children are that susceptible group. And so we are seeing actually a higher proportion of unvaccinated kids getting hospitalized with Omicron. And so there's, I would just underscore what was said earlier, that level of population immunity, the vaccine and some prior infection has probably blunted the effect in large swaths of the population.